Welcome to The Explainer. Today, we are diving deep into a super common condition that, a lot of people have heard of but might not really know what it is or what causes it. We're talking about oral thrush.
So here's our game plan. We're going to start with what it is, then get into the why behind it, who's most likely to get it, and of course, what to do about it and how to keep it from coming back. Let's jump in. All right, first things first. What exactly is oral thrush? Let's pull back the curtain on the common signs that tell you something might be a little off in there. For a lot of folks, the first clue is a change they can either see or feel. These things that definitely weren't there yesterday, and frustratingly, they don't just go away with a simple brush of your teeth.
And here are the classic signs. That first one, the white cottage cheese-like lesions, is probably the most famous symptom. But it's not just about how it looks. It can feel like a burning sensation. Or maybe food just doesn't taste right anymore. It can even make eating and drinking pretty uncomfortable.
So, what in the world is causing all this discomfort? Well, the answer actually lies in a very common, very simple imbalance that's happening on a microscopic level.
Now, this is really important to get. This isn't some strange foreign invader you've caught from someone. Candida albicans is actually a normal resident of your body's ecosystem. It hangs out with billions of other tiny microorganisms all the time.
And this slide, this is pretty much the whole story in a nutshell. Think of your mouth as this tiny, bustling rainforest. When everything is in balance, the good bacteria keep that Candida fungus from getting out of hand. But when something comes along and disrupts that delicate balance, and we're about to get to what those things are, it gives the Candida a golden opportunity to grow like crazy. That overgrowth is what we call oral thrush.
So this leads us to the next logical question, right? What are these factors that can tip the scales and throw this whole system out of whack?
As you can see from this breakdown, there's a pretty clear theme here. It's all about a compromised environment in your mouth or a weakened immune system. So for example, if you take a course of strong antibiotics, well, they can be great at killing bad bacteria, but they often wipe out the good guys too, leaving an opening for Candida. Or if someone has diabetes that isn't well controlled, the extra sugar in their saliva is basically an all-you-can-eat buffet for yeast.
And here's something you might not realize. Oral thrush can actually show up in a few different disguises. While those classic white patches are the most common, it can also look like red, raw, inflamed areas, especially for people who wear dentures. There's even a chronic version with tougher plaques.
Okay, so let's say you're looking at these symptoms and risk factors and thinking, some of this sounds a little too familiar. What's the next move? Let's get into diagnosis and, most importantly, the solutions. This is the big one, and the answer is definitely not to just ignore it or fall down an internet rabbit hole trying to diagnose yourself. The first most critical step is to get a proper diagnosis from a professional. And the good news is the diagnosis is usually really simple. A doctor or a dentist can often tell what it is just by taking a look in your mouth. Now, if they want to be 100% sure, or if it's a bit of an unusual case, they might take a quick, painless swab. Then they'll just pop it under a microscope to confirm that, yep, the Candida fungus is having a party in there.
When it comes to treatment, think of it like a 1-2 punch. On the medical side, you've got antifungal medications, things like gels, liquids, or sometimes pills. But at the same time, there's a ton you can do at home to help things along, like being super gentle when you brush, maybe eating some unsweetened yogurt to help bring back the good bacteria, and keeping those dentures sparkling clean.
So once the infection is gone and you're feeling better, the real mission begins, making sure it doesn't decide to make a comeback. And that's all about prevention.
And surprise, surprise, prevention all comes back to maintaining that healthy balance we've been talking about. And it's not rocket science, it's about the daily habits. Great oral hygiene, watching how much sugar you eat since yeast just love sugar, and really staying on top of any underlying health issues that could give that fungus an unfair advantage.
So if you remember just one thing from all this, let it be this: don't panic. Oral thrush is uncomfortable for sure, but it is incredibly common and very treatable. The real secret to success is working with your doctor to figure out why it happened in the first place so you can stop it from happening again.
All of this really shows us that our mouths are so much more than just a set of teeth to brush. They're these dynamic, living ecosystems. And that kind of leaves us with one final thought to chew on. Now that you know how delicate that balance is, what are the small changes you can make in your daily routine to help support your mouth's natural defenses and keep everything in perfect harmony?